am today is here. No matter how long it took me or what circuitous road lay before me. And where is here? Here is where I chose to work in a general kind of medical specialty where questions about pain and difficulty apply to both body and soul. Here is where labels cause more disability and suffering more than the actual disease that runs through the veins. Here is where sometimes I'm the only person who knows what's going on. And I can't tell a mother that her son needs her now more than ever. Here is where I talk about death and dying with young people on the very first day that we meet. In medical school, we were told to have a certain detached empathy when taking care of our patients. And this is really for our own self-preservation. Doctors who feel too much are criticized or stigmatized as weak. And I find this mandate quite challenging in my daily encounters. And the reason is, I have 1,000 reasons. Each reason is a person. A young man or woman who came into my life because of a virus that changed their lives forever. The human immunodeficiency virus, which we all know as HIV. Where I am now was never in the plans. Things happened that I guess made it inevitable that I take care of people living with HIV. As a fellow in training in the Philippine General Hospital, my idea of HIV work was limited to pure clinical work, and I was as green as can be. Until one day, I met someone who asked me if I wanted to take the road less traveled. And the reason was to save lives. That meant giving up a career in hospital work and academe and finding a way to reach out to the most difficult to reach young men and women. So together, this friend and I rented out a 20 square meter space in Mandaluyong, painted the walls one weekend with common friends who wanted to give back to the community, placed some paintings on the walls, got some colorful chairs, and set up SHIP Clinic, the first ever community-based public-private partnership HIV service delivery model in the country. All we basically wanted was a place where people wouldn't be afraid to get an HIV test and to get some treatment. So fast forward, 5 years later, we are now 1,000 strong. SHIP Clinic is still in the same place, but we added more chairs. There are more rooms, it's more colorful, but it still rings with laughter and joyous sounds from mostly me laughing at my patient stories. And it's exactly what we dreamed it to be. A place where the fear of having what was once a death sentence is reduced to a condition one just has to live with, to take medicines for, and not a barrier to realize one's own dreams in life. SHIP has grown then to expand beyond healthcare delivery to research, training of doctors, capacity building, innovations in HIV healthcare delivery, and working with the government in advising health policy. Remember my friend? My friend is gone now. He died on Valentine's Day, early this year, a day before his birthday. The person who dreamed that the road less traveled would give me a heart that is full is gone. But his dreams, our dreams, are still there. And we will work to achieve them. All that we do at SHIP is to uplift the lives of people living with HIV. Many people living with HIV in the Philippines come from the most stigmatized sector of the population. Stigmatized for carrying a disease that society blames them for. Stigmatized for being gay, for being a sex worker, for doing drugs. But what we don't know is that they are your children. They did not choose to have this disease. People with HIV would do anything to rid themselves of this virus. What we don't know is that they deserve to be treated like everyone else, with access to competent healthcare, and in fact, doctors with empathy. My friend said my heart would be full. He was right. But sometimes it overflows. And I owe it all to the right choice that I made 10 years ago. So for those who find themselves in a different place from plan A, don't fret. Where you are right now is where you are meant to be, at least for the moment. Let me share with you a poem by David Wagner that Jojo and Rodora shared with me a few weeks ago, which I found so inspiring for people who are aptly lost. Stand still. The trees ahead and bushes beside you are not lost. Wherever you are is called here. And you must treat it as a powerful stranger. Must ask permission to know it and be known. The forest breathes. Listen, it answers. I have made this place around you. If you leave it, you may come back again, saying here. No two trees are the same to raven. No two branches are the same to wren. If what a tree or a bush does is lost on you, you are surely lost. Stand still. The forest knows where you are. You must let it find you. I wouldn't be here despite being lost many times along the way without the people who were my source of strength and guidance. My parents, my mom, who is the funniest person ever, my dad, who assures me of a good meal whenever I come home. My friends since I was 11 years old sitting here in front of me who call me out whenever my head gets too big. My mentors, former TOYM awardee Dr. Atul Salvania. My colleagues from SHIP who are here today who share my passion, and for that I am grateful. I share this honor with 10 other people who themselves took roads that weren't smooth. I look forward to uplifting our country with you. To the Toym Foundation, thank you for this recognition, and I hope that you continue this worthwhile endeavor of inspiring people. Thank you.